Hello guys, Umar again with you with podcast number 4 today. I'm gonna talk about some abdominal cavity diseases. It will cover the treatment, the pathophysiology, the etiology, everything as I could explain. First of all, we have chronic pancreatitis. It's a long-term inflammation of the pancreas that alters the organ's normal structure and functions. It can present as episodes of acute inflammation in previously injured pancreas or as chronic damage with persistent pain or malabsorption. It's a disease process characterized by irreversible damage to the pancreas as distinct from reversible changes in acute pancreatitis. Etiology: among the causes of the chronic pancreatitis, we have the following etiology: alcohol, autoimmune disorders, intraductal obstruction, idiopathic pancreatitis, tumor, ischemia, classic stones, and that's it. The mechanism of chronic pancreatitis viewed from a genetic standpoint indicated early onset of severe epigastric pain beginning in childhood. It's an autosomal dominant disease. Chronic pancreatitis disease is identified in the cationic trypsinogen gene PRSS1 and mutation R122H. R122H is the most common mutation for hereditary chronic pancreatitis with replacement of arginine with histidine at amino acid position 122 of the trypsinogen protein. There are of course other mechanisms like alcohol, malnutrition, smoking, each exhibiting its own effects on the pancreas. The diagnosis of chronic pancreatitis is based on tests of pancreas. The diagnosis of chronic pancreatitis is based on tests on pancreatic structure and function. Serum amylase, antipase, may be moderately elevated in cases of chronic pancreatitis. A secretin stimulation test is considered the best test for diagnosis of chronic pancreatitis. Other tests used to determine chronic pancreatitis are serum trypsinogen, computed tomography, ultrasound, and biopsy. When chronic pancreatitis is caused by genetic factors elevations in ESR, IgG4, rheumatoid factor, ANA, and anti-smooth muscle antibody may be detected. On CT scan, pancreatic and bile acid dilation atrophy, atrophy of pancreas, multiple classifications of the pancreas, and enlargement of pancreatic glands can be found. On MRI scan, there is a low T1 signal due to inflammation, fibrosis, focal lesions, and classifications. In those who are given construct agent, there would be a higher T1 signal with late gadolinium enhancement due to compression from fibrotic areas. The overall thickness of the pancreas will be reduced. Magnetic resonance cholangiopancreatography (MRCP) is the most useful option in assessing the pancreatic duct and bile duct. As we talk about treatments, the different treatment options for management of chronic pancreatitis are medical measures, therapeutic, endoscopy, and surgery. Treatment is directed when possible to underlying cause and to relieve pain and malabsorption. Insulin-independent diabetes mellitus may occur and need long-term insulin therapy. The abdominal pain can be very severe and require high dose of analgesics, sometimes including opiates. Alcohol, cessation, and dietary modification like low-fat diet are important to manage pain and slow the calcification. Antioxidants may help, but it's unclear if the benefits are meaningful. Pancreatic enzymes replacement is often effective in treating the malabsorption and steatorrhea associated with chronic pancreatitis. Treatment of CP consists of administration of solution of pancreatic enzymes with meals. Some patients do have pain reduction with enzyme replacement, and since they are relatively safe, keeping enzyme replacement to chronic pancreatitis CP patients is an acceptable step in treatment for most patients. Treatment may be more likely to be successful in those without involvement of large ducts and those with idiopathic pancreatitis. The surgical treatment. Surgery to treat chronic pancreatitis tends to be divided into two areas: resectional and drainage procedures. Among the reasons to opt for surgery is if there is a pseudocyte, fistula, ascites, or a fixed obstruction. The first two producer may be used for treatment of the chronic pancreatitis. Before I end the chronic pancreatitis, I just forgot to mention about the symptoms that include in the chronic pancreatitis. We have upper abdominal pain in the feels worse after eating, eating, losing weight without trying, and oily smelly stools like steatorrhea also. That was all for the chronic pancreatitis. I want to now talk about the cholongitis, which is an inflammation of the bile duct system. Like the bile duct system carries bile from our liver and gallbladder into the first part of your small intestine, the duodenum. In most cases, cholongitis is caused by bacterial infection and often happens suddenly, but in some cases it may be long-term, like chronic. In some people, develop inflammation and cholongitis as part of autoimmune condition. In most cases, cholongitis is caused by blocked duct somewhere in your bile duct system. The blockage is most commonly caused by gallstones or sludge impacting the bile duct. Autoimmune disease such as primary sclerosing cholangitis may affect the system. Other less common cause of cholangitis, it may be a tumor, blood clots, a narrowing of duct that may happen after surgery, swollen pancreas, blood infection by bacteria cause. If you have had gallstones, you are at greater risk for cholangitis. Other risk factors include having autoimmune disease such as inflammatory bowel disease like Crohn's disease or ulcerative colitis, recent medical procedure involving the bile duct area, having human immunodeficiency virus, HIV, also traveling to countries where you might be exposed to worms or parasites. Symptoms of cholangitis: we have chills, fever, nausea, vomiting, dark urine, low blood pressure, lethargy. Of course, the main one, pain in the upper part of your belly. The pain from cholangitis can feel a lot like pain for gallstones. To be sure you have cholangitis, your healthcare provider will look at your past health and give you physician exams. You may do like CBC, a complete blood count. You may do liver function tests. You may do blood cultures like the CBC to measure the blood count. Liver function test is for the liver function to check it, like a group of special tests that can tell if your liver working proper or not. Blood cultures is a test to see if you have a blood infection or not. You also may do an ultrasound or sonography, same, which can create images of your internal organs and a computer screen using high frequency sound waves. You may do CT scan, you may do an MRCP, ERCP, and also PTC. For the treatments, first of all, it's important to get diagnosis right away. Like most people with cholangitis feel very sick. If you have cholangitis, you will likely be in the hospital for a few days. You will be given fluids by intravenously, line enough through a vein. You will also have pain medicine and bacterial fighting medicine like antibiotics. You may also need to drain the fluid in your bile duct and find the cause of the blockage. In most cases, it is done by a method called ERCP, like endoscopic retrograde cholangiopancreatography. To drain your bile duct, ERCP, a long, thin, flexible tube endoscope is put in your mouth. The scope goes down your food pipe through the esophagus and into your stomach, passes into the first part of your small intestine, the duodenum, and into the bile duct. The doctor can see inside of these organs and ducts on video screen. This video screen connected to camera in the scope. Sometimes tube is left to the outside to drain bile in. In this situation, a small tube passes into the duct to drain fluid. This tube pours out through the skin where it lets fluid drain out until the infection and inflammation clear up. You may also have film tubes like stents put into the bile ducts to keep them open. Gallstones can also be removed in most cases. This thing can be done using the ERCP scope. You may need a surgery if treatment doesn't work. We may prefer surgery if treatment doesn't work or if the patient are getting worse. Surgery will open the bile and reduce buildup of fluid. Now let's talk about another disease, cholycistitis. Cholycistitis are redness and swelling, or you can say inflammation of the gallbladder. It happens when digestive juice, bile duct, gets trapped into the gallbladder. The gallbladder, we all know, is a small organ under the liver. It stores bile which is made in the liver. Normally, bile drains out of our gallbladder and into our small intestine. If the bile is blocked, it builds up in the gallbladder. This causes inflammation and can cause infection. Cholycistitis can be sudden or long-term, like can be acute or can be chronic. And the cholecystitis happens when a digestive juice, bile duct, trapped into the gallbladder, as I said. In most cases, it happens because lumps of solid material, like gallstones, which are blocking a tube that drains bile from the gallbladder. When gallstones block the tube, bile builds up into the gallbladder. This causes irritation and pressure in the gallbladder. It can cause swelling and infection. The gallbladder stores bile. The gallstones are formed into the gallbladder. They are made from bile, don't forget. Other causes, like for example, bacterial infection in the bile duct system, is the drainage system that carries bile from the liver and gallbladder into first part of the small intestine, the duodenum. Tumor of pancreas or liver also can be a cause. A tumor can stop bile from draining out of gallbladder. Another cause, reduced blood supply to the gallbladder. This also may happen in case of diabetes. Gallbladder sludge. This is a thick material that can't be absorbed by bile in gallbladder. The sludge builds up in the gallbladder. It happens mainly to pregnant women or people who have had very fast weight loss. So take care, go on a healthy diet plan. Never be worried about how fast you will lose your weight. Lose it slowly but healthy to don't get cholecystitis. In the most cases, the attack of cholecystitis lasts 2 to 3 days. From each person, symptoms will be different. Let me talk about some symptoms. First of all, intense sudden pain in the upper right part of the belly. Pain often worth the deep breath that spreads to the back or below the right shoulder blade. Nausea, vomiting, fever, yellowing of the skin and eyes, jaundice, loose light colored bowel movement, belly bloating. There's different ways for diagnosing. For example, we can apply complete blood count against CBC. We must check the liver function, ultrasound, belly x-ray, CT scan, HIDA scan, hepatobiliary scintigraphy, PTC, ARCP also. For the treatments. In the hospital, treatments may include taking the bacteria fighting medicine, antibiotics. They will give you antibiotics in the hospital to fight the infection. They will give you maybe intravenously some painkillers. You must keep your stomach empty until the pain will be released. The symptoms may get better with the treatment, but if the cholecystitis is caused by gallstones, the gallbladder will need to be removed. Gallbladder removal, called cholecystectomy, is a common surgery. The body will work well without the gallbladder. It's not essential for healthy life. It may have the surgery done right away. If it is too steep to have surgery, a small tube may be put through the skin and into the gallbladder. This will drain the bile and ease the symptoms until the patient can have surgery. Other treatment options may include oral dissolution therapy, like some medicines made from bile acid are used to dissolve the stones. Medicines these are used to prevent gallstones from forming. Low-fat diets, of course, when you are allowed to eat food again. In some cases, cholecystitis can cause problems. Let's talk about the complications. What are the complications? Infection and pus build up in the gallbladder, tissue death in the gallbladder, like gangrene, bile duct injury that can affect the liver, infection and inflammation of the pancreas, pancreatitis, peritonitis, maybe, which is infection and inflammation of the lining of the bile. If the gallbladder has not been removed and patient have more attacks of cholecystitis, the patient may develop chronic cholecystitis. Chronic cholecystitis may not cause any symptoms, but it can damage the walls of the gallbladder. The walls can become scarred and get thicker. Patient's gallbladder will start to get smaller. Over time, it will be less able to store and release bile. The patient will need surgery to remove the gallbladder at the end. The patient should call the doctor or an ambulance if the patient has severe belly pain that won't go away if cholecystitis symptoms come back after the treatment also. So now let me talk about the gallstones pancreatitis. Gallstones form in the gallbladder, but in case gallstone pancreatitis, the stone travels from the gallbladder and blocks the opening to the first part of the small intestine, duodenum. This causes backup of fluid that can travel up both the bile duct and the pancreatic duct. Gallstone pancreatitis can be very painful and life-threatening if not treated. Severe pain is the most symptom of the gallstone pancreatitis, but it's not the only symptom. Like you have chills, fever, jaundice, nausea, pain that feels sharp or squeezing in the left part of abdomen or in the back, pain that radiates from the original side up to the shoulder or chest. Vomiting also. Gallstone pancreatitis is diagnosed by using combination of tools. The most common are blood tests and different types of body scans. Blood tests can be identified inflammation in the pancreas. CT scan, MRI, or ultrasound can give a clearer picture of severity of the pancreatitis. It can also tell whether gallstones is stuck inside the pancreatic duct and needs to be removed or not. The gallstone pancreatitis usually requires hospitalization if the inflammation related to the patient's pancreatitis is mild. Not eating and drinking for a few days until the patient's condition. During this time, doctors may give you fluid intravenously. In cases where the patient may not be able to eat for a long time, the patient may feed through a special tube and sometimes into the vein. Doctors will also treat the pain and nausea, if any, with intravenously medicine. Often this will be enough to get the patient's stone to pass through the body and resolve the pancreatitis. In more severe cases, gallstone pancreatitis, the surgeon will remove the gallstone. This will be done through a surgical procedure or the endoscopic, depending on the patient's condition. The patient may need to have the gallstone removed right away. He might be able to wait until after 48 hours receiving fluids directly into the vein. This allows the inflammation to ease first. The doctors may recommend surgical removal of the gallbladder after its pancreatitis has resolved. This will greatly reduce the chance of getting gallstone pancreatitis in the future. If gallstone pancreatitis goes untreated, the complications can be very serious. Digestive fluids from the liver, gallbladder, and pancreas may back up into the body and lead to an infected known as cholongitis, as I explained before. The patient may also develop yellowish eyes and skin, which is called jaundice. The tissue of the patient's pancreas itself can even begin to die in a condition called pancreatic necrosis. Ultimately, gallstones pancreatitis can be fatal if not treated. It's not possible to completely prevent gallstones pancreatitis because it's not possible to completely prevent gallstones from developing. However, patients can take steps to reduce the gallstone risk, like he can eat a healthy diet, stay at a healthy weight, keep his cholesterol level within a normal range, and manage diabetes if he is taking a medicine that contains estrogen. The patient must ask the doctor how this might add to the risk of the development gallstones. Gallstone pancreatitis symptoms, especially severe pain, are clear warning signs. If the patient have any of those symptoms I talked before about, he must call and help for a medical care right away. Let that be all for today. Let it be just small, fast podcast. And step by step, I'll talk about the abdominal cavity diseases like the abdominal cavity organ disease, for example, liver, pancreas, stomach, and small and large intestines, gallbladder, and other things. So have a nice time. Umar was with you again. Bye.